Hello, everybody. How are you doing? Welcome to another show. This is Friday, and we are here with a new episode of Healthcare Show and Opportunities for Innovation. All of my shows, I talk about the source of innovation, then we talk about the opportunities, and then we take some samples and examples from how other people are doing it in the market, how startup ventures are taking place, and most important, our focus is always how people are taking public policy, reading it right, and implementing it into an innovation. So the most important thing here in United States is public policy. They are the genesis of, especially in healthcare, in genesis of innovations. So today we are going to talk about a very, very specific and very special, very close to my heart um, subject. It's called value-based healthcare. So quality over quantity. It's always quality wins. So quality over quantity. This is what we are going to talk about. The reason it came to my mind this morning because I was talking to one of my physician friend, and he is a pediatrician. He mentioned to me that, Kunal, the whole thing is changing. The landscape of healthcare is changing. Reimbursement systems are changing. Payments are changing. And now a lot of the primary drivers for this is how Medicare paying for you instead of paying for the quantity or the number of patients you see. Instead of that, they're paying for the quality of healthcare, the outcomes you produce. And that is the most important thing here in the United States, especially in healthcare. So whoever is listening me, whether they are listening me here in the United States, globally, some people are sitting in India or wherever they are, this one particular thing you have to understand it very well, that the quality over quantity is a winning driver or a principal driver for innovation in healthcare. So, if you want to innovate in healthcare, you have to see from a quality perspective that how this outcome is going to affect a patient healthcare, whether a patient is going to have better healthcare or a patient is going to coming back to my original, coming back to my original thesis, and then I will also show you the slide. One second, I wanted to show you this slide because there's one slide I really want to talk about here is um, startups based on this value-based opportunity. But before that, so these are the startups which I wanted to talk about and give each startup an example how these startups have implemented some of those value-based programs into their approach and have become some of them are hugely successful, some of them are still in the phase of due diligence, and they are starting up some of the programs. So one of the startup which you see here, Health Hive PBC, and all of these information is available online. You can see it. I'm just basically taking the information from there and explaining it to you what it is. But when we talk about this Health Hive, what it does is it creates a uniquely structured digital space to allow patients and their families to meaningful participate in their care without changing the existing workflows of the institutionals involved in that care. So, through sharing records, resources, communication, Health Hive gets everyone on the same page. So, it's like a cloud, your personal cloud, where all the information is stored. So, at any point of time, somebody wants to see somebody's medical record, they can go with their probably login passwords and see it. So, it's a structured digital space to allow patients and their families to meaningfully participate in their care. Another one you see here is Flex Together. What it does is it basically enhances the recovery for older adults following an acute health episode. So the online program provides friendly health coaching, accessible health education, and joyous exercises tailored to the patient stage of recovery. So what happens, I'll give you my example. I was having pain in my spine, and the doctor, uh, orthopedic physician, I consulted with, he suggested to go through routine physical therapy, home exercise programs. But there was no way for me and for them to monitor it. So I like this. What I read here that researchers estimate that 30 to 50% of patients are non-adherent, which is true because that happened in my own case. So with my own physical therapy, I thought I would do yoga somewhere else, and I would do some of my programs, and I can do those things by myself. Uh, hmm. They're saying no. Is that right? There's no. Hello, hello. Can you hear me now? Can you hear me? Hello. Somebody told me they can hear me, but now I'm testing it. It doesn't seem to be coming to me. So uh, let me see by myself. Just testing it here. So let's see how it. Can you hear me now? Can you hear me? Can you hear me now? Can you hear me now? Just testing it here. So let's see. Well, that sound is coming. So can you hear me before? Can you hear me now? Okay, we'll talk about some of the things which we missed out, but I was talking about the startups which has implemented the value-based healthcare in their program, and one of those I was talking about was um, wins. So we talked about Health High, we talked about Flex Together. Flex Together was a startup basically which talks about the um, Can you hear me now? So with this, so these are the startups, and what they do is, I'll keep it short because looks like there is some technical problem. I think I'm going to change this program from next time because this is always giving us the problems. But these are the startups who have significantly implemented the value-based opportunities in their business model. And where there are three things are very important. One, how you can identify the opportunity the um, by reading the CMS requirements and the public policy well. So if you can see those public policy and you can read it well, then it is something which would give you the foundation of the working out together or helping together. The second thing, which is most important, is the implementation of that policy into action. So when you do that policy into action and create a business model where you can help implementing that policy in a physician's environment or in a hospital environment, that becomes a business model for your startup. And that business model uh, will basically become a tool for somebody to implement and impact the outcome. So it's not only just impacting the outcome, but also it becomes uh, either tool to reduce cost, it becomes a tool to increase the comfort. So like in our case, we talked about Flex Together. Flex Together was a tool which can create a monitoring system for people to monitor their behavior. So if somebody wants to have online classes um, for having their physical therapy lessons, they can do it. Similarly, patient pattern, neuropath, your coach, my formulary, you can go online, you can search about them, what they do. But basically that model helps patients to improve their outcomes or physicians to reduce the cost of care. And based on those parameters, you get paid by Medicare if you do the reporting part correctly. So the third and most important part is all of these tools provides a reporting mechanism in the hands of a physician. Because if there is no reporting mechanism, all of these tools have no value. So read the public policy, pick the pick the opportunities from there where you can create tools and technologies to help reduce the patient reduce increase the quality of patient care and reduce the cost. And the third thing is the reporting, how you can provide that reporting back to CMS. Because all of these, if it is not reported, so for reporting mechanism, you have to read about MACRA, MIPS, APMs, all of these tools, because all of those programs provides a guide, a fundamental guide, how to report back to Medicare so that the reimbursement can be increased. And that's how this entire uh, the the quality over quantity, um, value over volume, all of that concept is based on that fundamental policies. With this, if I have any questions, I'll take it, but I don't know if my voice was not heard in the entire program, but I can go back and talk about some of those programs and value-based programs again. But if it is, otherwise I can always do another program next Friday. But with this, I'm going to take a leave and thank you very much. Thank you very much for listening me out here. And if anybody has any question about this stream, please send me a text here, send me a message on LinkedIn, and I'm happy